If you fell ill in the ancient world, your greatest threat was often the treatment itself. Childbirth carried staggering mortality rates, and conditions like mental illness were routinely met with superstition, isolation, and iron shackles. But if you lived in the Roman province of Asia Minor during the 1st century CE, you would find a stark exception to this dark age of medicine, the coastal city of Ephesus. Under the reigns of emperors Trajan and Hadrian, Ephesus developed into a medical powerhouse. The city invested heavily in public health, building formal medical academies, hosting rigorous competitions to certify physicians, and constructing massive therapeutic bath complexes for hydrotherapy. While the surrounding world largely relied on magical incantations and physical force, Ephesus cultivated an intellectual ecosystem based on strict observation. This unique environment created the perfect conditions for a medical revolution. Out of this advanced Ephesian system came Soranus. Born and educated in the city's medical academies, he traveled to Alexandria to further his training before establishing a highly successful practice in Rome at the peak of his career. Soranus practiced the Methodist philosophy of medicine. This meant discarding folklore and localized magic and instead organizing observable physical data into strict, rational categories to determine the correct treatment. He chose to apply this methodical compassion to the most vulnerable yet historically ignored demographic in ancient medicine: pregnant women and newborn infants. Soranus exported the empathy and rigorous science of his hometown directly to the heart of the Roman Empire. By bringing rational methodologies to maternal care, he established a completely new standard for treating patients. His life's work culminated in gynecology, the first comprehensive scientific manual dedicated entirely to women's health and childbirth. In antiquity, childbirth was entirely managed by midwives, who relied on localized, often dangerous folklore. Soranus wrote his manual specifically to provide these midwives with rigorous, scientifically grounded instructions. His approach was remarkably holistic. He insisted that the psychological care of the mother, reducing her anxiety and offering constant reassurance, was just as critical to a successful delivery as any physical intervention. When physical interventions were required, Ephesian-trained physicians possessed highly advanced surgical technology, allowing them to perform complex, rational procedures that were previously impossible. By providing actionable, written protocols, Soranus elevated midwifery into a respected scientific profession. He brought clinical dignity to women's healthcare. Inside the delivery room, Soranus engineered specific tools like a specialized birthing chair, using gravity and ergonomic positioning to assist the mother during labor. He implemented strict environmental controls, demanding a calm, quiet atmosphere with regulated temperatures to actively reduce maternal stress. Once the child was delivered, he established precise hygienic instructions for handling the newborn, detailing exact methods for swaddling and safely severing the umbilical cord. He then required midwives to run through a strict checklist of criteria to immediately evaluate the physical health and viability of the infant. This diagram compares Soranus' ancient infant checklist on the left with the modern APGAR score on the right. The APGAR score is the standard clinical test given to newborns today to assess heart rate, breathing, and muscle tone, and the overlap is stunning. These were highly actionable, life-saving protocols. By applying strict methodology to the delivery room, Soranus drastically improved infant mortality rates nearly 2 millennia before the advent of modern hospital care. Soranus applied the same humane logic to the mind. The standard ancient practice for treating mental illness involved locking patients in dark rooms, binding them in chains, or starving them. Soranus prescribed the exact opposite: plenty of rest, good nutrition, moderate exercise, and brightly lit rooms. He replaced physical restraints with gentle occupational therapy, engaging patients in reading, vocal exercises, and structured conversation to calm their symptoms. Through his Methodist approach, he systematically dismantled the ancient belief that mental illness was a moral failing or a demonic possession. He proved it was a physical condition that required deep empathy to heal. Soranus served as a vital bridge between eras of medical history, even authoring the first known biography of the legendary Greek physician Hippocrates. When the Roman Empire collapsed, countless scientific, philosophical, and medical texts were lost to history, burned, or left to decay. Gynecology survived because the medical community deemed it too valuable to lose. Later physicians, like Cellius Aurelianus, meticulously translated his Greek text into Latin to ensure its preservation. These Latin translations became the absolute standard reference manual. Detailed illustrations of fetal positions drawn from his teachings guided doctors and midwives well into the Middle Ages, remaining authoritative until the 16th century. While empires crumbled and borders vanished entirely, this single Ephesian text preserved the light of rational, humane medicine for over a millennium. Today, modern gynecological terminology and foundational obstetric practices still bear the direct influence of his ancient writings. The legacy of Soranus is forever grounded in the marble streets and stone amphitheaters of ancient Ephesus. He demonstrated that rigorous scientific methodology and profound human empathy are deeply connected forces. You cannot accurately observe a patient if you do not first respect their humanity. An ancient physician from the coast of Asia Minor laid the foundation for the modern medical world, leaving behind a simple, enduring truth. True healing always starts with compassion.